Welcome to Health Law and Ethics video. Health law and ethics, importance thereof. Now, what is the health professional should abide by, and what is the ethical behavior that health professionals should be looked into? They are supposedly supposed to uphold the ethical standards to the highest possible level. Why? Because they are playing with the health of an individual. It is a matter of life and death. So this codes of ethics serves as a guidelines for the health workers and the paramedical workers or staff or caregivers are concerned. Let me start with the definition of health. Health is a state of physical, mental, and emotional well being. And I am not saying it, it is WHO's definition. Again, it's a state of physical, mental, and emotional well being. Illness is opposite of health and includes various diseases, or should I say the lack of basic necessities. Policies as a supportive environment for health. Health is a global concern and requires a holistic approach. Public policies plays a very crucial role in promoting health equity and assessing various health issues. Now, allow me to give you these strategies for effective health services. First, it should be the equitable distribution of health resources. Second, population control and family planning, very important. With the spiraling of population, the health services can go haywire. So it's proper to have uh, due decorum as far as the population growth is concerned. It should be mapped with the projections of the government, the federal government of any country per se. They should be aligned with the food security. The growth of population should be made available with the growth of foods or availability of the food. It should be a matter of uh, great shame if a single individual of a country goes starved himself or herself in a day just because of the lack of food. This can only be done, the population control of family can only be done if there is a proper education and literacy, if there are safe housing and sanitation. Health education is a mandatory requirement as far as occupational safety awareness is concerned. And above all, you have to understand the mortality rate of the maternal and the child health services are very critical. In fact, in many developing countries, the mortality rate of children below the age of 5 years is considerably very high. So let us understand the health workers' responsibilities. First, they should gain knowledge about everything which is related to their work area, like linkages between health and human rights policies, international organization impacting health, psychosocial aspects of illness, factors promoting health and well-being, socioeconomic and political determinants of health, environmental factors affecting health, global disease burden, and specific issue like HIV or AIDS, human immunoviruses, or acquired immuno syndrome, which we are looking into it, the women's health, disease prevention theories, treatment modalities, both modern and traditional, and impact of working condition on health. We need to understand that all paramedical staff, all caregivers, all extension workers with related to health, they should have a proper understanding about the health policies, the human rights, the psychosocial aspects, why health is so important, what is the global disease, what are pandemics, how to deal with them, the women health issues, and so on and so forth. So let us understand the public health versus medical ethics. Public health professionals have a moral obligations to provide public health. Public health ethics differ from medical ethics because public health focuses on population and not on individual. Public health emphasizes prevention over cure. Importance of code of conduct for health extension worker. The code ensures the ethical conducts in public health service delivery. Public health ethics address equity, justice, equality, and human right. I repeat, Public health ethics is all about equity, all about justice, all about equality, and all about human rights. So, public health ethics is all focused on a macro level on the population and not on a micro level as an individual, and they are more preventive in nature rather than curative. So, key areas of HSEP, Health Service Extension Program, is all about health education, making people aware of the pros and cons of leading a healthy lifestyle, of a hygienic in a living in a hygienic environment, nutrition, hygiene and sanitation, family health, immunizations, malaria, TB, HIV prevention and control, and first aid. We are all talking about vaccination that needs to be understood, nutrition, proper nutrients in terms of variety of food that needs to be consumed, family health and immunization is to be looked into it. So, informing people is essential, as in sensitizing them the population, because to ensure that there is no spread of viruses, no spread of diseases. In fact, we should be preventing diseases and controlling them in the very first instance. This can only be done if people are aware of, if we lead a proper healthy lifestyle, and it is not individual responsibility, it is the society's responsibilities and community responsibilities, prescribing the do's and the don'ts and ensuring that everybody is adhering to the do's and the don'ts with respect to the health service. Adapting health ethics to local context. General health ethics principle exists globally. Each country adapts this principle based on culture, religion, social norms, and public health services. I repeat, country adapts this principle based on culture, religion, social norms, and public health practices. So, what are the core behaviors of the health service professionals? Are supposedly you need to have a morality, as in distinguishing between black and white, between right and wrong. Moral acts involve knowledge, freedom, and reason. Moral acts can be good, bad, perfect, imperfect, positive, or even negative. So we need to understand what is we are doing it. Importance of ethics for health professional. Identify moral and ethical issues. Make informed decisions about client care. Respect human rights. Basic ethical principle, the principle of autonomy, the principle of beneficency, doing good for the largest number of people as much as possible. Non maleficence, absolutely refraining from doing any harm or even ensuring if you are not able to do something good, at least to not do anything harmful or detrimental. Justice, as in fairness, principle of truth telling, as in the honesty is concerned. Allow me to give you a little peek into the historical development. Ancient civilization, that of India, that of Egypt, that of Babylon, had legal restriction on medical practices to protect the public from unqualified practitioner. The Justinian Code, way back 529 after Dominion AD, established requirements for doctors' education, examination, and limitation on the number of doctors per town. Medieval Europe saw further advancement with regulation like Edict of Roger II of Sicily, that's 1140 AD, requiring medical education and qualification. Hong Kong, as an example, established its medical registration ordinance in 1884 to regulate the medical practices. Now, let us talk about the law. Law defines acceptable medical practices and set consequences for violation. Now, people cannot play with the health of a common citizen. In the name of research, you cannot just remove an organ just to see how functional or how dysfunctional that the person might be working around it. So yes, we need to have laws and bylaws to understand what are the consequences and what are the consequences in cases of any violation that happens. Legal framework may include educational standard and licensing requirement, disciplinary action for misconduct, codes of practice set by medical council, regulation by medical institution as the case might be. The role of medical ethics are self imposed codes guiding proper conduct. The Hippocratic or 5th century BC is the earliest known example. The World Medical Association Declaration of Geneva 1948 is a modern reflection of these principles. The medical ethics focuses on moral obligations and may not be directly enforceable by law. So let us talk about the face-off between laws and ethics. Laws and ethics can overlap in areas like confidentialities and malpractices. Both aim to protect public health and maintain good medical standard. Doctors must follow the law to avoid legal repercussions. Ethical principle may influences law development, but aren't directly enforceable. In rare cases, legal obligation and ethical duties may conflict as the case might be. So, reason for increased scrutiny, advancement in medical technology poses new ethical dilemmas. Public awareness of legal and ethical rights is on the rise. Increased media coverage of medical lawsuits and negligence claims. Shift from paternalistic to a patient care centered care, as the case might be. Let us look at the impact of the medical practices. Rise in the patient right organization or the advocacy group, as it is commonly referred as. Increased litigation against healthcare providers. Growing importance of informed consent and patient autonomy. Patient autonomy in the case as in what prevention methodology that the patient will like to adopt or not. Focuses on quality assurances and definitely on reduction of errors thereby. So, allow me to give you the key areas of clashes between legal and ethical concern. It is the doctor-patient relationship. We are talking about trust, confidentiality, informed consent. Then it's an end of life care, withholding, withdrawing treatment, or euthanasia, where the doctors might be allowing the patient, or the patient might have requested the doctors to let them go. Reproductive medicines, abortion, surrogacy, prenatal testing, as in prenatal testing as to find out the gender of the child yet to be born. And depending upon the gender, there are certain cultures which might continue with the pregnancy or might terminate the pregnancy. Resource allocation, fair distribution of limited healthcare resources, medical researches, ethical treatment of human subject, psychiatric care, involuntary commitment, confidentialities, pediatrics, consent for minors and child abuse, medical errors and misconduct, disclosures and accountability, medico legal issues, doctors as expert witness in court. The way forward is integration of medical laws and ethics educations into medical curricula, continuous learning and awareness of healthcare professionals, open communication and collaboration between doctors and patients, development of fair and ethical healthcare policies. This, once we adhere to, we will have a definitely much developed community and society at large. With these words, let us wind this particular video. Thank you for watching it till the end.